we are the most famous physical therapists on the internet.
In our opinion.
In our opinion. All right, today, Brad, we're going to talk about FootDrop, and we're going to keep it pretty basic here, but we want to describe what FootDrop is and just some of the basic bracing they might try. We're certainly no experts on it. We're not orthotists at all. Right. But we do want to show you what is available, so to let you know, by the way, when you have the brace, it really isn't very apparent. It's really pretty well hidden. So, what are the cases in which you might get FootDrop?
Well, real commonly in the clinic, we'll see it with stroke people. People have a stroke, one side, that leg is not going to work well, and the foot. Can you drop down on this? Let's describe FootDrop, because some people aren't clear that. So,
well, first, can we just show on my foot, Brad, how the weakness is bringing the foot up this way?
Right, dorsiflexion we call that.
Yeah.
The anterior tib muscle, the muscle belly is right here. The tendon comes down and it contracts and pulls your foot up. Yep.
And I can't do that. If Brad asked me to do that, I wouldn't be able to lift it, or if I did, I couldn't hold it up there, which is he could easily push it down.
Right. So that's. So if I let go, it just drops right down. That's called FootDrop.
That's FootDrop. Just as it describes what it is.
Right. So we've got that with people with strokes, polio, there's a spinal nerve that's impinged and it doesn't allow that muscle to.
Yeah, my mom got it after back surgery.
Sure.
FootDrop.
That's common after back surgery.
And probably one of the most common ones now where we're going to run into it is a peripheral neuropathy, which you get from diabetes.
Some of the older people, I've had some patients that had polio.
Polio, yep.
It's
multiple sclerosis is another one. You never know where the weakness is going to show up with that. So.
And one of what we call a gait pattern, are you still down here, Nancy, is you can actually hear the person coming. What they'll do is they'll bring up their foot like this and they'll come down because they're unable to do a heel strike, we call them, come through. So they have to lift up their foot here, and sometimes you can hear them slap that foot down.
Foot slap, yeah. Mm-hmm. The knee is also tending to, let's say it's on this one, they bring up the knees, sometimes back knees on them too, because they don't have that support.
Yep, it'll hyperextend, and so it can lead into knee problems from the FootDrop. It makes a high risk for falls. So an AFO, it's an ankle foot orthosis. Yeah.
Orthosis, I looked this up, Brad, is Greek for alignment or straighten. So what we're trying to do is align the foot or straighten the foot. So an orthotist makes braces that align or straighten. And that's what, now what this is actually is one that's off the shelf. And it comes in different sizes. This is a medium. And what you're going to find now, they have a great variety in how these braces look. And they're all trying to do different things. They're all trying to provide pressure points at different spots. But this is the old, what we call the Salmons one, is what I used to call it, because Salmons used to provide these, S-A-M-M-N-O-S, M-O-N-S. So this one is actually a little bit small for me, but I'll show you how it works, unless you have further comments right now, Brad.
Well, one thing, is they make these for style. I mean, you can get colors. You can
absolutely.
Green Bay Packer emblems on there.
Yeah, why would you? But yeah, So they're trying to help out the younger person that may have to wear it and make it more of a fashion statement. But again, as I'll show you here, it really doesn't show much. Unless someone's looking for it, a lot of times you really don't even see it. So
unless you're wearing shorts.
Unless you're wearing shorts, yeah. So you're going to pull the pant leg up, you're just going to put it on there. A lot of times it has two straps now, sometimes it's a strap around the ankle. But again, this basic one probably only has one.
Almost always Velcro straps.
Yep, easy to apply. Now, you're going to slide the shoe over, and as Brad and I were talking, in some cases, especially with maybe a custom-made brace, you might actually have to have a shoe that's a little bigger. You might have to actually get a shoe that's one size bigger, which is a real pain, we understand. But now this is my normal shoe, and it actually feels fine. Right. So.
This is, again, he said off the shelf, and that's versus a custom. And a custom AFO, they actually cast your leg, and they send it in. And I just got the price on one of these from one of my patients. It was over $900.
And that's what I saw online, anywhere from $600 to $900. So yeah, they're very expensive, where these are, I don't know, what are they, 30, 40, 50 maybe?
Right, depends on where you get them.
And these can be molded too. I mean, once you get it, you can use what is called a heat gun. And you wouldn't be doing this obviously, but it can be molded a little bit, so if it doesn't fit quite right, You can
take it to your
adjustments.
orthotist and they'll take care of it in a matter of minutes.
I've even seen, I've done it a little bit once in a while, but see, once the pant leg is down, you don't even see it.
And because of that on, you know, he's gonna come down, he's gonna heel stake
Yeah.
tight, it's not gonna drop. It
Right, it's
eliminates-
gonna hold my foot up.
Right.
Now, if you have weakness in your hip, which I've seen sometimes, where
Sure.
people have weakness all the way along the leg, they still may drag the foot.
Yeah.
So then you gotta work on strengthening your hip, but otherwise, yeah, this holds up my foot right, it actually feels pretty good.
Yeah.
I'm kinda surprised.
Yeah, you're right, it looks good, you can't even tell it's there.
So that versus, this is a molded one, and they usually use like a polypropylene.
Mhm.
And this is a molded one with actually a hinge on it. And you would normally wouldn't need to go to this extent for a foot drop. This is more providing what we call lateral medial stability, where your ankle could possibly turn, you know, where you have a ton of weakness in your foot. Probably from a stroke where you don't have any strength at all, and you're at risk for turning your ankle too, and not just the foot drop.
When it comes to these more complicated ones, they're usually custom, and I usually just go send my patients to the orthotist.
Right.
And they take care of it all, they're the experts, and, you know, they'll answer a lot of questions, but just so you know, there's the hinge ones, and there's other variations.
Oh
too.
yeah, there's a whole plethora.
Plethora,
There you
excellent,
go.
it's a haiku.
All right, thanks a lot.